How exactly does Bufdir work to raise awareness on the different types of violence?
Well, we do many things. First of all, we work with the services so that people working in services have both good knowledge on what kinds of violence, how to see it, how to help people. We also work towards the general public through different websites. The Directorate has a website directed at youth, for example, called youth.no, which offers knowledge-based information for children and youth from the age of 13 and up about many subjects. So kids can go in there and search how to get a driver's license, for example. And this place they can also find information on violence and abuse. And we also have a website directed at parents with all kinds of information that parents might find useful, but also information on how to control one's anger. If you have a difficult situation disciplining your children, for example, and also how to talk about your young children or teenagers about sexual abuse and violence among youth.
Who would you say are the most important stakeholders in this kind of work, and how do you cooperate? How is that organized?
This area of government is divided between very many government agencies, as you mentioned. So some of our most important partners in this are other directorates, for example, in the health area, in the justice area. We also work with the services, of course, the different services, providing both health services and more specialized services for those who are exposed to violence or have issues concerning violence. And of course also NGOs, different organizations representing the users of the services are important partners for us in developing our work.
What would you say are the biggest challenges with this kind of work?
That's a very difficult question because there are so many challenges. But of course, one of the big challenges concerning working against violence in close relationships is that this is a phenomenon that happens within the four walls of an apartment or a house in the private sphere. And it's difficult for a public agency to reach within that sphere. Also because being exposed to violence in close relationship is sometimes viewed as shameful by those who are exposed, and it's also viewed as shameful to be someone who exposes other people. So it's difficult for both government agencies and services to get in a position to help. And of course, there are also so many different reasons and challenges that these families who struggle with violence are facing. So it's difficult to find the right measures to actually help them.
Do you have any thoughts on how we can work to meet some of these challenges, specifically how your agency can work towards that?
We have a number of measures that I think are good, that are directed in a way that can help them early. For example, we have one measure which is called Nurse-Family Partnership that we're trying out in Norway, which is a program that is aimed at helping first-time families coping with pregnancy and the first period of having a young child. And these are specially trained nurses that help support the young families through home visits and really close follow-up on different issues. And the goal is to prevent violence and to get a better life for the whole family. So that's one way. And another way, I think, is as these families all very often have very complex needs and complex problems, we need to work together. Different services have to be able to work together. So to work with different competence measures, to raise awareness and knowledge about the different services, the different mandates, the different roles of the services, so that they can better work together and create a trusting relationship with their clients. That I think is important.
Are there any other examples or best practices that you'd like to highlight?
Well, within the child welfare system, we also have some other kind of multi-systemic approaches to problems also concerning youth, where a team or a specially trained therapist goes in and helps the family and connects the different areas of the family's lives. For example, school, maybe some health services that are needed, maybe social services that the family needs, so that you can sort of fix the different situations that cause problems for the families.
Are there any areas that you feel there should be more focus on?
I don't know if it's missing completely, but I wish that we had more time and resources to work with preventive measures, and to really find out what works. And we know from research on prevalence, we know that there are some risk factors. Of course, all families in all walks of life can be exposed to violence, but there are some risk factors that we could look into more to be able to prevent more violence than we are able to today.
When you say that, are there any specific risk factors in mind?
We know that families in the lowest socioeconomic spectrum are more exposed. We know that those children who have parents who struggle with substance abuse or mental health issues are more exposed. We also know that LGBTQ kids are more exposed to violence, and also in some cases minority youth.
We also know that both men and women are exposed to violence, but research shows that women are exposed to a greater extent. So I'm wondering, how does your agency work to ensure that the rights of women and girls are protected within this broader definition of violence in close relationships that Norway uses?
Yeah, some people are concerned that Norway has a too gender-neutral approach to violence, in that we are also talking about men and boys being exposed to violence in close relationships. But we like to think about it as having a more gender-inclusive approach. We are definitely very aware of that women and girls are to a greater extent exposed to the more severe violence and the more repetitive violence. But at the same time, we think it's important to remember that also some boys and men are exposed to very severe violence, and that if we don't talk about them, maybe the taboo concerning men exposed to violence and sexual abuse will grow instead of being dissolved. So it's important that men and boys also feel that they can seek help. So we have to talk about them too. But there are some in some areas we have to talk specifically about violence against girls, and one of those examples is sexual violence, where especially young girls are exposed to a much greater extent than boys, although some boys are also exposed to this kind of violence. So we have, for example, made sort of information guidance to teenage parents to talk to their teenage boys and teenage girls about this, about the risk of sexual abuse in relationship with parties, drinking, etc. So that's one example where we go in trying to protect that very vulnerable group of young girls from being abused, and also young boys from being abusers, actually. And of course, much of what we do concerning the shelters for survivors of violence, domestic violence, is not only directed at women, but women are our main focus group, since women are the main users of the centers.
As you're mentioning, men can also be victims of violence, but I think we know that few of them seek out these shelter services. So is there anything we can do as an agency to reduce the barriers that keep men from seeking help?
There are, I think, as I mentioned, talking about it, including men and boys in the discussion, so that they feel that when we talk about violence and sexual abuse, that we also talk about their experiences, not just the experiences of women and girls. That's one thing. We can also work on improving the services so that men feel welcome when they come to the services. For some of these, you can just imagine if you have, we have 43 shelters and only 130 something male users, or at least not male users, but male men living there, staying there during a year. So, and the law says that they have to be separate. They have to be separate from the women. So I don't believe that all these shelters for men are as good as the shelters for women, who have much bigger user group. So one of the things we are looking into is the possibility of a shared integrated shelter for both men and women. That might be might make it more accessible for men, especially men with children.
On that note, we do know that there's a lot of stigma surrounding reporting violence in close relationships, and that statistics from the police and shelters only really show the tip of the iceberg. So what would you say are our most important sources of information besides that, and how can we produce a solid knowledge base that can then better inform policymaking?
Yeah. In this area, we definitely need knowledge and data from the services, not just police, but also the shelters, the NGOs, the health services. And we need knowledge from the user organizations, and we need knowledge from research. Both research, qualitative research on the services, but also the prevalence surveys that we are lucky enough to have a few of in Norway. We know that from some of these surveys, we've heard that quite a few of the interviewed survivors of violence talk about what they have experienced for the first time ever in their life with the researcher. So we know from these studies that it's true that there really is a large part of the iceberg below the surface that we need to shed light on. So one of the things that I also think that research need to shed some more light on is what are the barriers for people so that they don't speak, especially for children, I think, and young people. What can we do? How can we make our services, our teachers, our football coaches better at maybe receiving this kind of information? Yeah, how can we make it easier for people to talk about it? It's not that we don't want to hear consciously, but I think as human beings we are wired to sort of not come too close to violence. Violence is unfortunately very human, very much a human nature thing, but it's also something we don't like to engage with. So I think that even people who are used to working with survivors of violence, if you tell me one thing, I'm kind of okay. Maybe it's not that bad. Instead of asking more, what else have you experienced? So I think that's actually a training thing, but it's you need to practice and practice, but it's difficult.
Is there anything else you'd like to share with us?
Maybe only that I think it's important for people outside Norway to know a little bit about how we view violence in close relationships. That we have maybe a broader definition than many other countries. Regarding children, actually we have a ban on all disciplinary violence. So lots of actions that in many countries will be seen as natural ways of raising a child, like maybe a little slap or some harsh words, can be considered violence in the Norwegian context, psychological violence or physical violence. And also that we view close relationships as broader than just a nuclear family context. We look at broader family contexts, and we also look at other dependencies, like, for example, for someone living in an institution, the people working there can be exposing them to violence, and they have a sort of dependency relationships.
Right, so it can happen in a lot of different contexts where sometimes you wouldn't even expect it, and the people who are supposed to protect you also might, unfortunately.
That's what often is the problem with this phenomenon, that it's the people that are supposed to protect you that are exposing you to something harmful.
And that makes it harder for everyone else to believe it also, I think.
Yeah.
Contributes.
Exactly.
Well, I think we have everything we need. Thank you so much.
Thank you.